SwitchPoint? All right, lukewarm, but okay. I promise I'll try to get you hyped up throughout this. My name is Crystal Lander. I'm the Director of Advocacy at an organization called Living Goods. Now, how many people have heard of it? Very good. I talked to most of you yesterday. Great. And Living Goods works in East Africa, and part of our job is digitizing community health workers so that they make a huge impact. We heard from our keynote speaker this morning, and I was totally moved, thinking, please don't let me go on right after her, about the power she's doing in her community and really speaking around the world on the power of saving women's lives, particularly in childbirth. So part of our role at Living Goods is to focus in on how we can get those community health workers to be a part of the solution she's looking for. So, again, a few of you heard of Living Goods before. A few of you may have heard of us when we first started. We're a social entrepreneur model of Avon. It was like the Avon door-to-door health services. Well, we've evolved a lot since then. We still do that a bit because we really believe in the power of community health workers to be in the communities where they work, but they have to be supported, supplied, salaried, and completely engaged in the local community, okay? So, what do we know about community health workers when they have the supplies they need to do good work? They make a huge impact. One of the things Living Goods has been doing is we've been focusing in on looking at the power of technology to predict results for the future. So again, by using community health workers in our local community, by giving them smartphones similar to the one I have in my hand, they've been using that information to predict analysis. They also do the simple things about predicting information and being trained on childhood illnesses and family planning services and all those things, but they're also taking in that data and using it to help make predictions about future outbreaks or future health problems in the local community. We use that vast data that we collect, and we take that information and partner with the Ministries of Health in Kenya and Uganda, and we predict algorithms for the future. By harnessing that demographic power, what we're able to do is send resources to the communities that are more in need. And you know what? That's extremely important. So how do we know that this works, right? That's what it's all about. Well, in an independent research study, we found that in the communities in which we were working in Uganda, there was a 27% reduction in childhood deaths in those communities. That's huge. Anybody dying in childbirth is a problem, but to see childhood deaths reduced by 27% is huge. The other thing we knew, and we can use from our predictive analytics, is to find out that with 80% accuracy, we can diagnose or figure out which pregnancies will likely lead to a low birth weight. Again, these are things that help us prevent problems from the beginning. So, what are the keys to our success? Well, before I tell you about that, let me introduce you to someone. This is Rita, and I actually know her. She's a Living Goods community health worker. She works in Uganda, and she has been trained, like we've talked about before, on identifying childhood illnesses, family planning services, but she's also been trained on how to be an advocate, how to speak up and tell her story so that communities in her area have the resources they need to function properly. But many of you may know about women like Rita. We heard yesterday other community health workers and nurses who are doing great work in their communities. But I want you to think about Rita in another way. Rita's 50 years old, and she said it was okay to tell her age. And like many women in her community, she's thought about technology as more talking to her friends on the phone or family. Every now and then, she uses it for mobile money. She did not have access to a computer, and certainly not a tablet, and she certainly wasn't thinking a lot about how she could use those tools to make changes in her local community. However, that technology was right around the corner from her, but she did not have the access to it, and neither did many of the women who she knows. Well, fast forward a bit. So Rita began working at Living Goods, she got trained on how to use technology to support her work. And this is a little bit of what Rita sees on her cell phone now. She's able to take a look at families in her local community by entering some basic data, and then from there, she's able to tell stories about what she needs to do next. This is all, again, on her phone that she was trained on. Every day, we're constantly updating our algorithms and getting feedback from community health workers to make sure whatever they enter in here is simplified and makes sense to them. Again, the tool is only as good as the person using it. Rita gets a checklist every day, which is based on predictive analytics. In her checklist, it'll say things like estimated due date for a mother in her local community. It will also give her an idea of what tasks. Does she need to go back and visit, check in on a newborn? Has that mother seen a doctor recently, especially if she's just come in from a high-risk pregnancy? It also talks about additional other prenatal care needed around immunizations. She's also able to target other health posts in the area that are facility level that may offer other resources. Now, how does Rita know she's doing well? Well, her supervisor can tell her. Her supervisor, who usually sits hours away in the health post in the Capitol, can look right at the dashboard on her computer and see what Rita's doing. Once Rita downloads her phones, which again work without Wi-Fi or without data, once she syncs her phone, this is just a sample of some of the data the supervisor can see. And the best part about this is that supervisor can readily be in contact with Rita if she sees problems or she sees a potential for a stock out of a medicine. Some of these customized views are also able to tell you trends across a county or a district, or they can zero down to a specific community health worker. And with all that data being collected, the ministries of health, with their trusted partners, can look through it. And the power of this is this data belongs to the ministry and to the local community. They can see where there's problems, if they can see where there are a lot of babies being born in a certain area. And that's all really helpful for the long-term planning. This data that we've been collecting in Kenya and Uganda, we're working with the government to integrate it into their formal health system. So again, they can take the data, disaggregate it, and use it for other uses. But there's more. Now, many of you think about community health workers and what they do for others. But I want you to think a little bit about community health workers and what the power of technology means for them. Community health workers are people. Imagine that. We want to support them and what their future ambitions are. So at Living Goods, through the power of training and ongoing support, we are helping those community health workers build up their tech savvy. Someone like Rita, her exponential growth in her tech savviness has grown because of the training she receives. Along with her friends, she's now able to use her technology to use her tablet, look at Excel, look at forecasting models, and these are all skills that she takes with her. Now, she may stay a community health worker, but she may do something else. We've had community health workers come and work for Living Goods and in managerial positions. We've had others go to school and become nurses, and still others who will become elected officials in their local community. See, it's not just about them serving others, but about what they can get from it too. Now, these are a few community health workers. And you remember I talked about what the secret to our success is? It's really just them. The community health workers are the ones making the investment of their time and energy, and we need to think about what investments we can make in them so that they can be successful even beyond the work they do every day. So, for Rita, and for the thousands like Rita around Kenya and Uganda, we're proud to support them as part of the solutions to build community-based primary health care systems. We know that they are the power, they are the change that we need to see. When they're local and switched on, there's nothing they can do. Thank you.